Okay, so this is video 6-238. Thumb, index grasp, phalanx, long axis distraction, internal rotation, external rotation, anterior to posterior, posterior to anterior glide, lateral medial, or medial to lateral glide. Patient is going to be prone, or supine rather. On this one, doctor is going to be off to the side. I know the book says facing towards the patient, cephalad, but in order for the video to see this, and so that way I'm not in directly between the patient's legs, I'm going to be kind of off to the side a little bit. So patient, his foot is here. So my segmental contact, or I guess indication, rather, I'm going to back up. Indication is going to be loss of accessory joint movement in the toes, and then segmental contact point is going to be any of the joint spaces within the toe. So I can be at the proximal phalanx, I can be at the distal phalanx, and this is just going to be assessing movement in these joint spaces. So my footward hand at this point, or I guess my inside hand, is going to be at the proximal end of the distal phalanx, and then this is going to be at the distal end of the proximal phalanx, and then I'm going to add a medial to lateral glide of the great toe, lateral to medial glide, medial lateral, lateral medial, and then I'm going to add a anterior to posterior, posterior to anterior, and then a internal external rotation, and then a medial to lateral tilt, and then we can move up to the distal, go long axis distraction, anterior to posterior, internal external, medial to lateral tilt, and then we can move down. So I can go to the second toe, medial lateral glide, anterior to posterior, internal external, and then medial to lateral tilt, and then I can follow that all the way through. So while I'm doing this the whole time, I can assess the joint movement. So if I feel restriction anterior to posterior, I can pulse. After I assess movement, then reassess, medial to lateral. I guess this one would be lateral to medial. I feel restriction, pulse, and then reassess, medial to lateral, assess, pulse, reassess, internal. I guess this would be external, assess, pulse, reassess, then internal, reassess, pulse, reassess, then medial tilt, pulse, reassess, and then lateral tilt, assess, and then reassess. Or I guess pulse, then reassess.